Hey again, guys. Um, my name's Daniela. This is Module 3, and I am going to be talking about um, skills of a nursing leader, the results of my leadership questionnaire, um, the type of leadership or management structure of the hospital that I work in. So I'll get started. So first off, a great management team, in my opinion, is super helpful for a nursing unit because the management team supports the staff and the patient. Quality management makes staff feel well cared for. They want to be there. They know they're supported in their role. And in my opinion, it leads to better patient outcomes because staff satisfaction is high. Basic qualities I generally look for in a management team can include having like an open door policy. That way, if you have issues, you know that you could maybe just knock on the door, run in, and just discuss it with them real quick if they have the time. Effective communication, confidence in their decisions. I mean, they're the primary decision makers, so just being kind of confident in the decisions that they're making, but also including staff in their decisions, and listening to concerns and being open to discuss ideas from staff. In Chapter 7 of our textbook, Leadership and Management Nursing, managers have a huge role in planning, organizing, staffing, coordinating, directing, and controlling. Each of these roles can relate to staff um, because the management needs to be able to communicate well, keep staff on track to meet goals. They also need to promote ideals, and like the culture and like the goals of the organization, um, to the staff. And they also need to be able to deal with other issues like staffing, to be able to deal with conflict, to be able to deal with difficult patient situations, things like that. So when I took the leadership skills questionnaire, I scored high with interpersonal leadership. And according to our textbook, interpersonal leadership skills help a manager deal with conflict and motivate others. So the key for the nurse manager is to use other people who have different skills from them, because I was kind of surprised that was how I scored, I guess, you could say. But I think that one of the important things is that there are tons of other people on the unit, supervisors, staff, and it's important to kind of use other people because they might have a different skill set or a different way of managing than you, and that's not necessarily a bad thing. But I do still feel like it's key, for the nurse manager to articulate like the big picture, whether that's for the floor or for the organization, because staff we don't have that same big picture. Sometimes we think only about what we're doing, and management is able to kind of see the whole organization or the whole unit's goals. I found an article about interdisciplinary teamwork. It was published in the Journal of Occupational Rehabilitation, and the title of it is Transdisciplinary Teamwork, the Experience of Clinicians at a Functional Institution at a Functional Restoration Program. Sorry about that. And I'm going to include the citation at the bottom and the article itself. The article discussed a qualitative study that was completed in an organization who instituted the interdisciplinary model of care. The study actually found this model to be very successful, but to do that, it needed to include a clear definition of who the client population was going to be, communication, how important that was, and how the organization was structured needs to be factored into the model. They definitely found that the model was helpful if the client population tended to be kind of complicated, like they had a lot of comorbidities or a lot of prior issues. They also found in this specific study that the patients did have that. They had a history of chronic debilitating musculoskeletal pain, but they also had other issues on top of that they had been dealing with, whether that was surgery or pre-existing health conditions. Um, And the teamwork method would work well, I think, on the floor that I work on, and it would help patient outcomes um, because every member of the team would be on the same page. So, members of the team, doctors, nurses, respiratory therapists, physical and occupational therapy, things like that, mid levels. And on our floor, I think it would also be really helpful because it would help with cooperation between departments. So our floor works with the surgical, the cardiothoracic ICU, which is where all of our open heart patients come from, and then they come to our floor. And we really need to work closely with them because we want to promote positive patient outcomes. And to do that, we need to prevent patients from leaving the ICU too soon or from coming back for other issues. Um, so our manager and our supervisors and several of the nurses work directly with the CTICUs, nurses, nurse manager, and supervisor. And we've done several like partnerships that have basically turned into studies to collect data to see how we can improve patient outcomes. One of the things we've done is like preventing patients bouncing back from our floor to the ICU, and the one that we're currently doing is preventing post-op ileuses. So that's very, very important. So I think generally I would prefer a vertical structure for management in a hospital. And I say that like as the overall structure because it's challenging in a hospital because there does need to be order and policy for patient and staff satisfaction and for safety. And according to our textbook, again, Leadership in Management and Nursing, it is a more rigid structure in that there's an exact definition for every single staff member and how they fit into the picture. And it defines their specific responsibilities and goals. And according to the text, the difference between that and the horizontal structure is it provides more freedom for the management and staff. And I think that this method would be better for like a specific hospital like unit or floor. So the floor has some leeway in how it can be run, whereas the hospital itself kind of maybe needs to have some more strict structure in how everybody fits together and how everybody communicates. So generally speaking, communication is really the key. It's important for the transdisciplinary team model, and it's important for organizations to value their staff and try to work out a structure that values the staff and the patients. And I think there can still be a lot of freedom for management in that, and for staff, while still keeping patients and staff safe and satisfied. So, yeah, thank you for listening.